Dr. Ashby, I want to start with you first on this question. If, for instance, you did not test for pregnancy, would that mean that you are not pregnant, that maybe you could avoid becoming pregnant by not testing for pregnancy? It's a facetious question, but if you could just respond to it on the basis of coronavirus, because Donald Trump seems to think if you don't test for a thing, the thing goes away.
So, Joy, thanks for having me, first of all. I'm a Florida boy from South Florida. We're happy. We're proud of you, what you're doing. So you're doing big things, as we say down here in the island people.
You.
But
yes,
in terms of this whole discourse, the fact that I'm having to respond to the Trump about clinical medicine is ridiculous. Like, Trump needs to stay in his lane. Like, we went to medical school for a long time. We did training for a long time to speak on exactly what we're experts, what we have the expertise to speak on. And the fact that Trump is inserting himself into academic medicine, clinical medicine, is ridiculous. And he's just saying things that are completely wrong. There's a lot of politicians saying things that are completely wrong. And frankly, me representing medical professionals, we are pissed off. And we want homie to stay in his lane and not speak on medical evidence-based medicine if he doesn't understand it. It's insane.
It is insane. Claire, you have, school superintendents saying they're terrified. They're frankly terrified about the prospect of bringing children back to school when we've seen kids in summer camps get sick and then go home and spread it to who knows who. There are adults in these camps or adults at home. And some of these kids are even being hospitalized. You have Donald Trump's own son goes to a school that is not cleared to reopen. His own youngest son is not necessarily going to be back in school. When you hear public officials going along with this idea that they're going to reopen schools because Trump wants them to, even when scientists are saying it isn't safe, as somebody who is in elected office, can you possibly understand why someone would be more beholden to the president than to the health and safety of their own constituents?
Well, no, especially, Joy, if you take into account how he has botched everything. He has botched wearing masks. He has botched testing. He has botched tracing. He has botched the reopening of businesses and social gatherings. He is now botching the reopening of schools, and his own medical team has abandoned him. First, Dr. Fauci, now Dr. Birx. Last Sunday, she said very clearly masks should be mandated by governors. Well, that's not the Trump line. And then the Admiral, as you just played that segment, he said, forget about hydroxy. It doesn't work. So he is alone on an ignorant island with no science. And the sad thing is, in my state, there are still a whole lot of people that are listening to him and not wearing masks because they think it's showing loyalty to Donald Trump to not wear a mask. And we're having a huge outbreak in our state that is endangering lives of thousands and thousands of people.
And meanwhile, Dr. Ashby, I wish he was alone on that island, but there are people who are listening not just to him, but to doctors who say that, sleep, sexual relations with demons can make you sick, then saying, oh, by the way, take hydrochloroquine, it'll work, trust me, and getting millions and tens of millions of people following them. You have people who are now basically COVID deniers. Are you dealing with that in the hospital where you're treating these patients? And how does that impact health professionals when you've got people who simply deny it isn't real?
Another great question, Joy. It's frustrating. Okay, so just to give people context, there's 3 high-quality randomized controlled trials, which is a gold standard in medicine when we discuss research, that have said that hydrochloroquine has no effect and potential harm. And the fact that we're having this conversation with people who are not medical professionals and people who, for whatever reason, are just turning a blind eye to evidence-based medicine. So you're referring to the one physician that talked about her use of hydrochloroquine for her patients and her use of it for prophylaxis, completely contradicting all the research that we've done that actually had placebo controls that showed that it didn't work. And the fact that she's using her own anecdotal evidence to talk about her outpatient experience and saying that's the way we should do it is just ridiculous. And again, I shouldn't be talking about this on this show. This is a conversation we have amongst academics, the people that are treating the patients. We use the best standards of care so that we can have the best outcomes. And it's showing patients are doing better with treatment, despite the fact that a lot of our leaders are spewing misinformation out there wasting my time having me sit here and having to contradict someone that doesn't know what TF they're talking about. I got to use an acronym because I can't curse on here.
Yeah, no, absolutely. I mean, technically it's cable, but I get you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.